Hi, I'm Mark Padala. I'm a colon and rectal surgeon with McGovern Medical School, UT Physicians Colon and Rectal Clinic. And I practice in the Woodlands at Memorial Hermann The Woodlands Medical Center. So as a colon and rectal surgeon, we typically do three main body areas, if you will. The first one would be abdominal surgery, working on what we call or consider major operations, which typically would be for things like diverticulitis or inflammatory bowel disease, ulcerative colitis, Crohn's disease, or the main one that we're focusing on today, which is colon cancer. And then the next category would be diseases of the anal area like hemorrhoids and infections and fissures and painful conditions of the anal area. And the last is colonoscopy. And of course, colonoscopy is what we're here to promote for Colon Cancer Awareness Month, being the way to diagnose colorectal cancer.
I'm Tom Newton. I'm a colon and rectal surgeon. I work with the McGovern Medical School, UT Physicians Colon and Rectal Clinic, and I work at the Memorial Hermann The Woodlands Medical Center. I want to talk about the colonoscopies a little bit, because the biggest point of this whole discussion today is all about prevention of colon and rectal cancer. We can talk a lot about the treatment, but the treatment's sure a lot easier if nothing is needed. So the whole point is to get colonoscopies and get checked at an appropriate age. Right? It's always been 50 years old in the past, now it's 45. But a lot of people don't need to wait till you're 45 either if you're having any kind of issues, any kind of symptoms, change of your bowel habits, bleeding. These are the important things. You don't have to wait until you're 50 years old if you're having some sort of an issue. Or now that it's 45, a lot more people have been waiting for 50 and they're like, oh, I guess I need to come in now. And that's always the best thing to do. You don't need to have symptoms at all to get a colonoscopy. Colon cancer affects men and women equally, so there's nobody that gets to hide from all this. Everybody needs to get checked one way or the other, whether you're having problems or not. We all know of somebody who's always said, I'm not going to go get that. I'm not going to have a problem with that because I don't have any problems. But those are exactly the people who need to be checked, because colon cancers and colon polyps usually don't give us any symptoms at all. Most of the time, these things occur without any symptoms at all. That's why everybody needs to be checked.
Hi, my name is Jill Schwartner. I am 41 years old and I have 3 kids. My oldest is a girl, Addison, and she's 13. I have a son that is 11 and another little one that is 8 years old. So I'm a very busy person. I do stay at home and we're just running ragged all the time. I guess it was last year, probably about the same time, or back in February probably, I started noticing a little change in bowel movements and didn't think much of it, just kind of pushed it aside because, you know, I've got 3 kids and I mean, I didn't even have like a regular doctor that I went to on a regular basis. I would just go to the minute clinic if I got a cold or something. So I really overlooked some personal health issues just by accident, you know, just kind of pushing it aside, putting my kids first, which I think is huge. But at the same time, moms need to take care of themselves and pay attention to these little things that are happening with them in case something might turn into something huge. And that was the case for me. The pandemic hit last year, so we really were kind of just quarantined, staying at home. I was, you know, I used to be a school teacher, so I kind of had that under my belt. But teaching 3 kids, 3 different grades all at the same time in one household was kind of chaos, but we got through it. And I just started noticing that I was spending more time in the bathroom, but not really, my bowel movements were just kind of all over the place. And I guess it was the summer I started to notice that there was blood in my stool. And really, that should have been a huge red flag for me because that was not normal. But I thought to myself, oh, I'll be fine. It doesn't hurt. Nothing's bothering me. You know, I don't have time to slow down. You know, I've got 3 kids and, you know, we're going through this whole pandemic and, you know, I'm going to be fine. Still, nothing really changed major. But I guess in August, towards the end of the summer, I would have cramps, but I kind of thought maybe this is like the female side of it. You know, I'll be fine. But when it started happening more often and it wasn't hurting horribly, but it was just a nagging pain. And feeling like I needed to have a bowel movement, but I couldn't, and I never had trouble with constipation or anything like that or hemorrhoids. So it's just uncommon for me. And it's not something that you want to talk about, like Padala said. I mean, it's not something you want to share with a doctor or even my husband. You know, it wasn't something that I just wanted to talk about over wine. And so I just didn't. And then finally he was like, you need to make an appointment. Like, you have to go. Like, call somebody. And I went and made an appointment with a practitioner and kind of told her my symptoms, and she thought maybe it was hemorrhoids or something like that. But went ahead and gave me a referral to talk to a gastrologist. So I called that next week and made an appointment with Anna Gonzalez. And I probably got in to see her, I think it was in November, right after Thanksgiving. And so it took a while to get that appointment. And in between that time, I really didn't have a lot of issues that changed rapidly, but they were more consistent. Like I was having more day-to-day symptoms and still not in any pain, really, that I can feel like I didn't want to be a whiner, I guess. You know, I just, you know, thought I could get through it and it was fine. I still didn't think anything was really wrong, but my sisters had polyps, and they found when they went and did their routine colonoscopies. And so they had said, well, maybe you have something like that, and, you know, just getting it early, you might see something, you know, and prevent something from changing. And so I had told Dr. Gonzalez kind of the past medical history, and there was no colon cancer in the family. So I just really, cancer was not even registering for me. Like, I didn't think about it happening to me. And so whenever I went and saw her, she kind of thought that, you know, it probably was not cancer because I was so young, but because of the family history, it wouldn't hurt to have the colonoscopy early and just to see what was going on to make sure. And so that I ended up making the colonoscopy. And I remember that day in the office, she's like, you know, it's up to you what you want to do. And I remember thinking, I don't need to do this. I'm not going to get a colonoscopy. I don't want to do that prep. And I had changed my mind right before I left. I said, okay, I think I'm going to go ahead and do it and just make sure and get ahead of it if it is anything. And so we scheduled it for December 12th. And I went in, I wasn't really worried at all. I was actually a little bit annoyed at my husband. And because he was the one that was making me go do it. And thank goodness he did. But I remember thinking, like, oh, all this, and it's going to be totally fine. But went in, had the procedure, woke up, and Dr. Gonzalez wasn't there, but the nurse had said that there was an area that she took some biopsies of. I didn't have any polyps, but there was just an area that she took some biopsies, and we'd get the pathology report within the next week or so. And still, I don't know if it's because I was a little loopy still, but I wasn't nervous about it at all. I still just did not think that it was anything serious. So I guess it was December 16th when Dr. Gonzalez gave me the call that, you know, hey, this is Dr. Gonzalez. And I remember thinking in my head, wow, the doctor's calling me. Like, that's pretty impressive. Like, usually it's a nurse or, you know, something like that. And she's like, just, hey, it's Dr. Gonzalez. And whenever she got my attention, she said, I got the pathology report. Do you have a second to talk? And I said, yeah. And she said, you have cancer. You have colon cancer. And it was kind of it was an emotional moment, for sure. You just don't think that you're going to hear that. And then it happens, and sorry. It's just not something that you're prepared to hear. I don't even think if I thought that I was, you know, something like that was going on, that was going to be, you know, something that I would have been ready to hear either. But she was amazing. She said, you know, I think we're catching it early. I have already set up an appointment to see an oncologist. He can get you in tomorrow, and then I can get you in to another colleague that's a surgeon on Friday, and we will get you on a fast track to figuring out our next steps. And I mean, it was beyond amazing how they all worked together, even though they were all at different places. You know, they were all working together for me, for a patient, and they knew that I needed it to happen quickly. And I was thinking about my kids, and, you know, that first day was the only day that I let myself be emotional. I'm a pretty positive person, and I like to see the good in everything. So, I mean, I had my little crying tantrum, but I quickly resolved, and I knew that I had to be strong for my kids, and that I needed to just get on a path of optimism and just go. Like, I wasn't going to slow down, and not that there wasn't any like hiccups or moments where I was like, felt a little defeated, but I felt like everything was going good. And once meeting the oncologist and Dr. Padala, I knew that I was in the best hands, and that God just put me on a path that was going to be righteous, and I was all in. And I knew that my surgeon and oncologist and Dr. Gonzalez were all in it with me. And they were determined to help me come out on the other side, and that's exactly what they did. So I went and saw the oncologist, and, you know, we have to do so much blood work. I mean, I've never been pricked so much in my life. It was just, I barely went to the doctor. I mean, I was a healthy person. You know, I don't eat horribly. I don't really work out, but I don't eat horribly. I don't smoke. I don't do anything like that. So it was out in left field for me. But everything that we were, our plan of action, it was just a lot of tests. We wanted to do a scan, a full PET scan, to make sure that there wasn't any cancer anywhere else. And that was a scary part of it for me, because just waiting to get that PET scan, and then insurance was always fun to deal with. But just getting the PET scan and knowing for sure that it wasn't anywhere else in my body. And Dr. Patala did have to do an exam before, just to make sure how far or how clear and how far up was clear before the actual PET scan, I think. But that was good. That all turned out well, in my favor. So the surgery, after the PET scan came back and blood work, I was severely anemic. My iron level had depleted to, I believe, 8, and so I ended up getting a series of infusions, iron infusions, which was supposed to help with the surgery recovery. And the first surgery date was set. I mean, everything was just a whirlwind. Everything was happening so quickly. And the first surgery date was going to be on December 31st. So found out on December 16th, and the surgery was set on the 31st, which was amazing that they could even get it on the calendar and fit me in. But then you have to go do the COVID test right before. And so that threw us for a loop, because that came back, I felt fine, and that came back positive. So we had to push the date to January 12th, which it wasn't a big deal, but, and it still was very fast paced. And I mean, I barely had time to think about it. And I did get to enjoy, Christmas and kids' birthdays. So that was nice. But the surgery itself was I prepped for it the day before, and came in, and everything at the hospital was just pristine. And Dr. Patala was really good about checking in with me beforehand and kind of going over again exactly what was going to be happening. And of course, being a girl, I was asking about, so can you tell me again where those incisions are going to be? And he was like, well, and granted, yes, I want the cancer out. It doesn't matter about the incisions, but he went over that with me again. And honestly, everything went perfect. I remember right before they were wheeling me to the OR, I was already kind of, the medicine was already kicking in. But I remember reaching back to the nurses that were pushing me, and I said, can you please pray for me? And they were all they were kind of laughing, and they were wheeling me back to my husband so that they could say a prayer. I don't even think I heard the prayer. I think I was out before that, but it felt good knowing that they were all, so helpful and willing to do that for me. And, woke up from the surgery and felt really good. Couldn't really complain. Of course, you're sore and everything, but surgery went well. It was a little over, I think, 4 hours, my husband said. But, I have 4 incisions starting right here down, and then a larger one at the bottom. But honestly, everything went perfect. It couldn't have gone better. And the care at the hospital was amazing. I had some fantastic nurses at Memorial Hermann, And I just really feel confident that I was in the best hands possible for my surgery to remove the colon cancer. And upon going back for our follow-up visit, Dr. Padala had to take, I believe it was 14 of the lymph nodes surrounding that area, and it all came back negative. So that was the best possible outcome. I did not have to have any chemo, which was also fantastic. I feel beyond blessed that I actually had the colonoscopy, and my husband pushed me to do that because it was not something that I was jumping to go do. And, you know, I think a lot of moms out there don't really think about themselves when they've got so much going on. And that's why I wanted to share my story and just provide awareness, even though it's not something that you want to talk about. You need to, and you need to take care of yourself when you're noticing little symptoms like that, even if it's not hurting, because I really wasn't in pain. It was just not normal. And occasionally there would be some cramping, but it would come and go. It wasn't all the time, so I just would dismiss it for another time. And so I think it's important for not just moms, but everyone to pay attention to their body and get screened early, because it saved my life and it can save yours.
So we have a lot of examples that we could discuss of patients who have come in early, and we believe we've saved their life by a combination of doctors doing things to help them. In fact, we've developed a rectal cancer tumor board here at the Woodlands, where we have radiation oncologists, medical oncologists, pathologists, radiologists, colorectal surgeons. We all get together twice a month and we discuss all the rectal cancer patients, for instance, because rectal cancer in particular has become what we call multidisciplinary, which means there's a lot of doctors. It's not just the surgeon that's manning the ship. And so what we do, at least in this tumor board, is we discuss every patient that we operate on at this hospital that has the diagnosis of rectal cancer. And we come up with an individual plan for that patient with multiple disciplines involved. And with that, we've seen some pretty cool results. For instance, we had a patient who had all the therapy and the cancer went away. That was a young person. We have a patient today that we took care of, and Jill's going to tell you her story. But Jill noticed, very much like we said, a little change in her bowel movements. I believe her sister went and had a colonoscopy and had some polyps, so that kind of alerted her that something wasn't right. And then she put that in with the change in bowel habits, and she came to her gastroenterologist. A colonoscopy was done, and Jill unfortunately had a colon cancer. And then she was referred to us. We evaluated her. We did a lot of imaging, CAT scans, and blood tests, and it looked confined to the upper part of the rectum or the end of the colon. And so all looked really favorable for her. She had an operation several weeks ago. She did great. And thank God, all her lymph nodes were negative. It was an earlier stage tumor, and we were so happy for her, of course, and her family, and we're thinking and hoping and praying that we've cured her.
Colon cancer is the second most common cause of cancer death in the country. It's behind lung cancer, and then in women, breast cancer is higher. So it's like the third. It's kind of a complicated thing. It's the third most common cancer in women, and the third most common cancer in men, but it's the second most common cause of cancer death among everybody. Cancer gets a bad rap for a lot of good reasons, and people often ask me, what is it that I can do so I don't have to deal with cancer later on? And as far as colon cancer goes, there's a lot you can do, because so many other cancers we have no control over whatsoever. this is one of the few that if you act in time, you can completely avoid it and cure it completely. And that's with getting screened at early ages, or at the right time. Starting at 45, getting colonoscopies, and you stay on regular colonoscopy schedules, it's 90% preventable.
So there's several different screening methods for colorectal cancer. Today, the best test for colorectal cancer would be a colonoscopy. And we do screening colonoscopy on patients who have no symptoms. So that's the definition of screening, is taking a patient with no symptoms based on some criteria and doing a colonoscopy to see if they have a non-symptomatic cancer or polyps that we can remove. Currently, or traditionally, the age has been 50 years old to get your colonoscopy, and it's been like that for decades. But recently, about 2 years ago, the American Cancer Society lowered that age to 45, simply because if you look at the people, or if you look at people under 50 years old, there's been a steep rise in colorectal cancer in that group. So to target that group, they lowered the age to 45 for screening.
It gets a bad rap sometimes having a colonoscopy, but really it's a quite simple procedure. It's the day before the colonoscopy that people talk about. That's a day where you have to get prepared, where you have to flush everything through your system and get cleaned out first. So you're on a liquid diet for an entire day. You drink a laxative that's going to help flush everything through. You're going to go to the bathroom several times. But then usually the very next morning you'll show up for a procedure. You get an IV, you get some nice sleepy medicine, you take a little nap, you wake up and you're done. It usually takes less than an hour, and the doctor can get a real good look inside your colon. And if you're having any sort of polyps or anything that looks strange, they can take a picture of them, you can biopsy it, polyps can be removed, and then you don't get colon cancer at all. Usually someone drives you home, but then you may get to go 3, 5, 10 years maybe even before you need to have another colonoscopy.
Being nervous about talking about colon issues or bowel movement issues is universal. So I would tell patients that they're not alone. Everybody feels the same way. However, if you flip the coin, colon cancer is preventable and colon cancer is curable if you find it early enough. And so the push is to find these precancerous polyps before they develop into cancer. And now we're changing someone's entire course of colorectal cancer, in that hopefully that patient doesn't develop colon cancer because you remove this precancerous thing called a polyp, and change their path in life regarding colon cancer. But the other thing is to find it early, if indeed you have it, when it's not symptomatic, because we can cure people 95% of the time if it's early enough. If you wait until the symptoms have been going on for 3 or 4 years and people come in with a little higher stage, it gets a little more tricky to cure that patient. So it's important to prevent and to find early to cure. So the reason why they lowered the age is, again, if you look at people under 50 years old, the incidence or the number of people developing colorectal cancer over the last few decades has more than doubled. If you look at people over 50 years old, the incidence or the number of people that have colorectal cancer diagnosed has decreased. And the reason for that is felt to be related to the screening colonoscopy starting at 50 years old. That's been promoted over the last several decades. Definitely with Colorectal Cancer Awareness Month, we're all pushing screening and awareness leading to colonoscopy. So in the group over 50, the numbers have decreased. But we weren't targeting the younger people at that time, and so we noticed that age group under 50 has increased. And so to target catching those patients earlier, they lowered it to 45.
We were talking about getting colonoscopies when you turn 45, but it depends on what your risk factors are. So we talk about bleeding and changing your bowel habits or things that might get you a colonoscopy sooner. But if you have a family history of colorectal cancer, people in your parents, brothers, sisters, say someone else has had polyps, someone else has had cancers, well then usually we're going to back it up even from what their age is. So maybe even 10 years sooner than what you would normally expect. Because the whole goal is, if your sister is growing polyps, maybe you're growing polyps too, you can get your polyps removed and we'll be way ahead of the curve.
So the screening, right now the guidelines are 45, but that's for the asymptomatic patient. That doesn't mean that if you're younger than 45, you should wait till you're 45 if you have symptoms. So we believe that, or physicians believe that anybody with symptoms should be checked by a specialist. And those symptoms, mainly for colorectal cancer, would include blood with your bowel movements, blood in the stool, a change in bowel habits. For instance, a patient may have a regular routine and they've noticed over the last few months things have changed. Number of stools per day, volume has changed, plus or minus throw blood in there, maybe abdominal discomfort, weight loss that's unexplained, and that whole package, or any one of those things, should lead to being checked. So the Rectal Cancer Tumor Board that we initiated several years ago is a national program that is under the American College of Surgeons, and they certify you for a center of excellence regarding rectal cancer in particular. Last year, because of the pandemic, that got put by the wayside, but in a few months we're going to be evaluated to see if we're going to become a center of excellence, and I think everything looks really promising. I don't see any reason why we wouldn't pass the test.
So one of the great things we have here at Memorial Hermann is we have a rectal cancer tumor board where we gather a lot of different types of doctors, not just surgeons, so that we can discuss patients that have colon and rectal cancer. In the past, we've just seen patients where the surgeon or an oncologist has to sit down and make a decision about what this patient's going to need. But now at these conferences, we can gather lots of doctors together and we can discuss what's important to each one of those doctors when we're talking about treating these cancers and these patients. And we've been able to get everybody's heads all together so that we can make better decisions for the treatment of the patients in the long run. And we've been doing that now for a few years, and it's really coming together quite nicely. We're going to be soon officially accredited as a center of excellence for the treatment of colon and rectal cancer. So what that means is the patient should feel better that they're getting the appropriate treatment. In order to be a center of excellence, you have to have standard of care that's been approved and which is basically recommended by all the College of Surgeons and the colorectal surgeons. There's an absolute way that you're supposed to be treating these things, and then there are some things that are controversial. But when you have a way to talk about it with all the different doctors and different specialists, you can be assured that you're going to have the standard of care. And not just with surgery, which would include minimally invasive surgery, robotic surgery, that type of stuff, but also with picking the right type of chemotherapy, the right type of radiation, who needs it, who doesn't need it, a lot of difficult decisions that need to be made.